Welcome to our Dream Deferred, a podcast that asks big questions and engages remarkable minds from a wide range of fields to help get underneath our unfulfilled American dream. I'm Tracy Waring-Evans.
And I'm Karen Heller-Key.
We're colleagues working in human services, a field that works in every community to ensure Americans have the building blocks to achieve well-being. People in our field work to remove the barriers that get in the way of well-being. And that means getting to root causes, including the ways our shared beliefs, culture, and social systems and structures make it difficult or impossible for people and groups to ever achieve the stability and prosperity we all want and are promised. These past few years, as our country has become more fragmented and long-standing biases have come into plain sight, we've searched for ways to understand what we're experiencing more deeply and to benefit from perspectives that can help us envision a path forward. Our Dream Deferred is our way of engaging with important and diverse voices and bringing them to our field and beyond. Across Season 1, we will weave conversations into a picture to help us see anew where we are, how we got here, and how we can find a new way forward. This week on our Dream Deferred, we are delighted to be joined by Dr. Wendy Ellis, who is an assistant professor in global health and the director of the Center for Community Resilience at the Milken Institute School of Public Health at George Washington University. She is a pioneer in helping Americans understand the ways in which experiences of trauma and adversity in families are deeply interconnected with the adversity experienced by whole communities, which in turn are rooted in systems. Reflecting both on our own life journey and on our country's history of marginalizing and harming Black, Brown, and Indigenous communities, Dr. Ellis takes us deeper into understanding the many seen and unseen forces, both stressors and buffers, that shape who we become and why. Applying a multidisciplinary lens, she offers critical insights into what it means to truly build community resiliency, including what is required of each of us, especially allies, if we are ever to live up to our promise as a nation. Before we jump into this episode, a note about the content. It includes descriptions of physical and emotional abuse and a brief mention of suicide that may be distressing for some listeners.
So nice to be here. My name is Wendy Ellis, Dr. Wendy Ellis, and the director for the Center for Community Resilience at the George Washington University School of Public Health.
On our Dream Deferred, we like to start with a question about dreams, your own dreams, and the American Dream Deferred that we explore in each episode. So growing up, can you share a dream that you had for yourself and how that dream was affected by the state of the American dream?
Yeah, I grew up in the shadow of my grandfather, who was an attorney in Cincinnati, Ohio. He was one of the early graduates, African-American graduates of the law school at University of Cincinnati. And he came out with a group of African-American men who had come through that program, who went on to work in public service. One went on to be a city council member. And it was at this time when we had this really great push following the civil rights movement of African Americans making strides as being the first. And my grandfather was certainly one of the first. He was the corporate attorney for Western Southern Life Insurance that's based right there in Cincinnati. And so in that time period of growing up and having this, man who was this great figure in my life, but also out of the ashes of the civil rights movement, and many of the adults in my circle who had been very much involved in the civil rights movement, there was a piece of me that was a bit envious that I had somehow just missed the party. Really just missed the movement. And here, I'm growing up at the feet of people like Nikki Giovanni, this great poet, and Fred Shuttlesworth, who's worked side by side with Dr. Martin Luther King, and the ashes of the riots in Avondale, which is a part of the largest Black neighborhood in Cincinnati. So it wasn't just the people and their stories, but there were physical remnants of the civil rights movement. And that energy of fighting for what is right and still trying to find hope for real true justice and keeping up that fight. That's what was my dream. It was, I may have missed this moment, but I know there will be others. And I know that this fight will continue. So my dream is actually out of the American dream for liberty and justice. That truly is what I cut my teeth on. And it's taken me almost 50 years to recognize how important that exposure as a child and that dream of being able to make a difference, particularly when it came to civil rights and justice for people of color, for those who have been disenfranchised historically in this country, that it lived in me continuously until the time that, whether it was a exposure from my previous career or my training in public health, where the time arrived, and certainly 2020, it was very obvious to me my time had arrived and my dream was no longer deferred. My dream was actually being called into action.
Wendy, I'm reflecting on what you've said, and this is going to be really great to weave together your lived experience with your professional expertise and background and your journey, which clearly are interconnected. One of the things we typically try to do on our Dream Deferred is to bring perspectives from a range of fields. And your background, I know, includes a doctorate in health policy, and you also work in a discipline that's sometimes called translational science. And you also spent time along the way as a television journalist. It's a really fascinating journey, and I'm just mentioning a couple of milestones along the way. So could you take us along on that journey and how it has brought you to the work you do today, and how it connects with that lived experience that you internalized from your growing up years?
Yeah, absolutely. I think that if one were to just look at my resume, you would think there's a lot, there's circuitous movement and not very well connected. But if you layer in the personal experience, I think the logic there becomes completely apparent. And so I've been quite open about the fact that by the time I was 17 years old, I had an ACEs score of 8. And I grew up with early on my father, who was extremely abusive, beat my mother every day that she was pregnant with me, really with the hope of somehow ending my life, and attempted to end my life later after he had shot my mother. He was also looking to shoot and kill me and was not successful in either. He did very much critically injure my mother with a head injury from shooting her, but he was not able to find me that night when he was searching the apartment with a gun looking to shoot me. The person that did die that night that I've never really talked about was the unborn child that my mother was pregnant with at that time. And so I have lived with a constant fear until 2 years ago when he completed suicide and finally answered his own demons by doing so. But I had lived with a constant fear of him actually being able to find me at some point and complete his circle of fury. And so that really much was this dark cloud that hung over my entire childhood. Now, I had 2 sets of grandparents who stepped in and provided sustenance, provided protection, provided the ability for me to be able to have somewhat of a normal childhood, as much as one can when you're not able to have a positive relationship with either one of your parents. But it put in me this idea that there was something that is so much larger than just myself, that there was some force that protected me from my father. And in the midst of, again, this idea that there's always something, a much larger force that was working in my environment. Remember, I spoke about the civil rights movement. I mean, this was all what was happening in the chaos that was happening in my personal life was also happening in the midst of chaos at the societal level. So the troubles of a little Black girl weren't really the main concern of really anybody. outside of my immediate family. So I sought refuge in storytelling, journaling, but I also was in a community that had a lot of supports, access to parks, quality public education, safe policing. So I didn't have a lot of immediate needs that were not met. I had a lot of needs for healing. And so that's where the larger community actually did help to contribute to that healing for me. So I somehow at 19 wound up in a radio studio in Cincinnati. I had dropped out of college to find myself, and my grandfather said, "No, you need to find a job." And so I got lucky enough to get an internship at a radio station that actually helped me understand the power of voice, the compelling nature of story, and the ability to lift up story in a way that could not only change hearts and minds, but perhaps change how we approach our society. And I did that for about 12, 13 years, wound up in television news as a producer. And wherever I went, and I had lived in so many different cities across the country and doing that, I was also at the same time working in community, really volunteering with Big Brothers, Big Sisters, Guardian Ad Litem, nonprofit organizations that were addressing the needs of children who had been exposed to abuse and neglect. And I never really stopped to self-analyze why I was doing this. It wasn't until 1999 when I was in Seattle and a little girl named Loria Grace died at the hands of her mother. And when we were doing the story, it became apparent that every system that was supposed to be protecting this child had failed. Whether it was CPS, Child Protective Services, whether it was child welfare, whether it was Seattle Police, whether it was the drug court that was monitoring her mother and her progress towards overcoming her substance abuse demons, everyone failed her. And the story broke my heart in many ways, but it also cracked open something that I didn't know that was right below the surface. And that was my own trauma. And that was my own understanding of just the fine line between those that we save and those that get left behind. And it is quite arbitrary, oftentimes, particularly if you're a child of color. And actually, I'll correct that. It's not arbitrary if you're a child of color. It's quite intentional, oftentimes. And so that was also at the same time that I'm doing this story that Anda and Folletti released that seminal study on adverse childhood experiences. And so in my research and doing the story, I stumbled upon that. And it was this great awakening, like, I get it. I get me. And I understand that there's a science behind all of this. And that's when the call went out internally that I can't just tell stories. I have to do something, and I have the opportunity to do something. So I left the newsroom, much to the surprise of many who were like, what in the world? Why would you leave this field? You're so good at this. And I thought, but I can be better. And there's so much more that I could be doing. And so I ended up going and working for 6 years, president of the board for Child Haven, which is an organization in Seattle that actually does interventional work with children who have been exposed to abuse and neglect. They have phenomenal returns on their investment, the social investment of reaching not only the child, but the parent early on to change that trajectory. But we were serving 86 kids a year. 86 kids a year in King County. You know that that's barely scratching the surface. And I, being a journalist and being naturally inquisitive, I wanted to know what's happening to the other ones. What's happening to those other kids that are not fortunate enough to be identified and being able to be treated, both them and their parents, at a program such as Child Haven. And that's how I stumbled upon the work at Echo Glen, which is a child juvenile rehabilitation. So it's a prison. but it's a prison that offers very high touch psychiatric services to children. And at the time, there was a director, Brad Beach, who was really doing some phenomenal and innovative work in meeting children where they are, using cognitive behavioral therapy. We're not just warehousing children, we're giving them the help that they need to heal. So yes, there's medication that's involved, but there was also education, there was therapy, and there was understanding, again, that 2-gen approach, that we have to treat the child in the context of their family, and then really also paying attention to what's happening in their community. And so that work, I went out there for 2 years and I thought, okay, I know exactly the hole that I need to fill in this field. We've got science that helps us understand the longitudinal impact of adversity. And we can see clearly that our systems aren't bridging the gaps. They're not connected in a way that best serve those who need that. And that's when I went back to school and got my master's at University of Washington and then moved to DC to get my doctorate here at GW. And it was that belief that we can make a difference, that I was fortunate enough to be able to access advanced education and then just doggedly determined that we can do better for our kids. So a lot of people go, well, my God, how do you go from television news to being a health policy researcher? And I'm like, well, isn't the transition natural? As a journalist, you have a license to be nosy. You ask all kinds of uncomfortable questions, which is data, qualitative data. You also have this thing called FOIA requests. So you can always get data that people don't want to give you, or they'll give you begrudgingly. And then you have to synthesize those data, right? You have to really analyze it and tell the story in a way that's going to compel people. So that is research. It's just applied in a very different way. But usually, well, I will say pre-O.J. Simpson trial, we used to actually do news that for a purpose. But I don't want to throw everyone under the bus. But I mean, the purpose of really journalism, good journalism, is to lift up those stories, lift up the truth, and let people make their decisions based on that unbiased analysis. And similarly, in research, we do the same thing, particularly in policy research. It's lifting up, being thoughtful with your analysis, but then lifting up where we have an opportunity to change. So for me, it's been quite a natural transition. And I would suggest every researcher go on that path. How's that?
I think that's awesome and so important, right, to really understand how any one of us shows up, what shapes us in the work that we do, how we show up every day, and then drawing on those strengths. This is really what you're talking about here in terms of a natural curiosity, wanting to go deeper, wanting to connect to community. And I really appreciate that you shared that glimpse of your journey, right? And we always know when we ask these questions, it's just a glimpse, right? We all have these different ways in which we've experienced life, and we would be here a while, right, if we were all talking in depth about the nuance behind it. But it's really it's appreciated. So we were first introduced to your work on building community resiliency through some organizations that we work alongside, and it resonated deeply with Karen and I as a key to a better way forward. And I think it would help level set for our listeners if you could share a little bit about what you mean by community resiliency, maybe including what it is not, right? Because sometimes we often don't talk about that.
Yeah, well, first off, it's not the American story of grit. So let's just level set that. And then also I want to do a level set on the word resilience in itself. We have taken a word that comes from physics, the science of physics. And, if you look it up in the dictionary, the word resilience means an object's ability to retain shape after suffering impact. Let's not apply that to the human body, to the human spirit. And so we're not looking at a literal translation of resilience merely from looking at it through the lens of physics, but really more so from a psychosocial perspective. So when we talk about resilience, and particularly community resilience, we're looking at not only a community's ability to provide supports and buffers in the instance of adversity, whether that's acute adversity, I should say. But we also realize that communities have to be outfitted in such a way that they are providing supports and buffers not only to bounce back from adversity, but to actually bounce forward and thrive. And that's really important, whether we're talking about trauma, whether we're talking about climate change, whether we're talking about political change. We have to have in place some sort of infrastructure that actually does give individuals an equitable opportunity to thrive, not that they are predetermined, predestined, just based on their race or based on their zip code. That's what resilience truly looks like. And that's why equity is at the center of this. So you asked me, how did I come to defining community resilience in this way? And it's a bit of a mix of the science of resilience, what we do already know from a personal, interpersonal level, looking at children and families, but also just based on my own experience. I was very open at the very beginning of this about my own adversity that I had to face. When you think about someone who has an ACEs score of 8 by the time that they're 17 years old, well, the literature shows us that I had a higher risk of substance abuse, that I would have not finished high school, let alone go off to have 2 postgraduate degrees, and I wouldn't have strong relationships. There would be a higher rate of mental illness, heart disease, diabetes. Really, at 54, should I even be here? My longevity, based on the science, says that, no, I've probably lost about 20 years off my life, and yet I'm here. And yet I still stand and am quite productive. Now, is that because innately I'm more resilient than others? I don't think so. I think it's to the point that I was making earlier. I never had to worry about food being on the table. My grandparents never had to worry about putting a roof over my head. We had vacations. I could run outside and play. I didn't have to worry about policing in my neighborhood. I was able to go to good public schools that the teachers knew our names. We didn't have police officers roaming the halls. We had parents who volunteered from time to time and would be roaming the halls and roaming the classrooms. And if I was stepped out of way, my grandparents would hear about it. My principal lived 2 doors from my grandmother, in fact. Miss Mangrum lived just right on the same street as we did on Zenzel Avenue in Cincinnati. So it was that sense of community. It was a faith-based community that my grandparents had a social network. So there was social cohesion in our community. And that social cohesion also translated into social capital. Our Kennedy Heights Community Council was well known by the Cincinnati Public School Board, was well known by the Cincinnati Council. So when those moms from our neighborhood council came down to City Hall, well, they were listened to. And so that really does speak to and is in line with all of the literature with regard to understanding the role of both social cohesion and social capital in building a resilient community, but also the role of systems in building and fostering even that social cohesion. Again, we didn't have a huge homeless population in our community. We didn't have to worry about where our kids were going to school because Cincinnati had some and still does have some of the best public schools in the country. That should not be an anomaly. And it wasn't impossible. And Kennedy Heights, the community that I described, was a predominantly Black neighborhood. So again, it was where the city had chosen to make those investments in a way that would promote the ability for an individual, a little Black girl like myself, with an extremely high ACEs score, to bounce forward and thrive. That's what community resilience looks like.
I'm struck by your observation, Wendy, that when you were working with one organization, you were reaching only a relatively small number of children, no matter how good the quality of the work was. And also your reflection on the role that your community played growing up in your resilience. You've put those insights to work, and we're really intrigued by the deep work that you've done with communities, a number of communities across the country through the Building Community Resilience Collaborative. Tell us what the collaborative is all about.
The collaborative is bringing together individuals at the community level, provider level, that really did have at their heart of their own missions this idea that we could be doing better for our children, and particularly coalescing around adverse childhood experiences. And why adverse childhood experiences is because when you look at the national data, you can see that this is not something that's happening to just those people, meaning people of color or the poor, that this is truly an American experience that cuts across all educational levels, all economic levels. And so when you're trying to build a movement, of which I will now reveal that certainly was my intent, but you can't tell people that at the beginning, right? You just want them to join in on a cause that they believe in. But if you really want to create a movement, you have to have some means by which people can have a common identifier. And so it was using adverse childhood experiences, this truly American public health issue, as a means to garner some level of central identity. And then using that parabasis framing was a way to get people to not only think about what's happening to individuals, but that context. Let's get to root causes. And obviously, from a communication standpoint, there has to be storytelling. You have to really contextualize this, and for each community. So that means that the parabasis tree is a conversation starter. It's not a definer. What defines the parabasis tree for each one of these communities is that community voice that tells us, well, in Portland, the issue is this growing income inequality, this history of white supremacy in Oregon, that Oregon was established as a white supremacist state, that many people aren't familiar with that history. In Cincinnati, it has been this long-standing issue with regard to the broken promises to communities of color, the constant community disruption that has created, and how that has contributed to this huge racial wealth gap in that city. So understanding that you can't solve the issue of adverse childhood experiences if you're not looking at root causes, that has really resonated with each one of the communities that we work with, but allowing them to identify what are on the branches and the leaves of the tree in our community and what's in our soil. That's how we created this durable network that many people would say the idea that you could come up with a national network and keep it together without actually paying people to do the work would be, oh, that's unheard of. Well, a lot of people will join a movement and stay in a movement, not for economic compensation, but to actually make a difference. And so that has really been the heart of this work, is being able to demonstrate the difference that we're making, whether that is in practice change, whether that's changing of programs, integration of programs, co-location of programs, appropriations, using and going to our federal lawmakers or our state or local lawmakers and reminding them that our budgets are moral documents. They're not just numbers and cents. They actually speak to where we have our values. And being able to have those compelling conversations with lawmakers, I think that is really what has kept our network together, and understanding that you do make a difference on the ground and you can be heard, and we can make a difference, measurable difference today that gets us towards equity over time. That's really what's the secret sauce is. If there's a secret sauce, it's being real with people and it's letting those stories be told so that we can make a difference.
Thank you, Wendy. And I think that really resonates with Karen and I as we think about how to move forward, bounce forward, as you say, and create frames or lenses that folks can apply that are, as you've talked about, so important to the context of community and getting at root causes in place and with people who make up that community. And I know you've done some really great work around using data and predictive analytics to help communities understand the changes they want to make to prevent or mitigate harmful outcomes for all people in the community. And so could you tell us a little bit more about the nature of that work and this idea of how can you harness predictive analytics for good use?
Yes, we have had in our building community resilience work this mantra: there's no data without stories, no stories without data. And a lot of folks have given lip service to this idea of mixed methods, qualitative and quantitative data. And how do you mix that and actually make it meaningful? And what we have done is really, number one, with that context work, understanding that what's in the roots, what's in the soil, oftentimes are these outcomes that are produced by systems. So when we're looking at data, it's first important to remember, what is it that I'm actually looking at? And this goes back to being curious. So let's be curious here for a moment and think about the data of social determinants. Social determinants are important. It's a very important body of work. Where we have perhaps missed the opportunity is how we actually look at these data on social determinants and interpret these data on social determinants. Yes, it is true that a person with lower educational attainment has a higher risk for chronic disease, for lower incomes and such. This is true. But what have we done with these data around social determinants? We've looked downstream and said, what can we do from a programmatic standpoint to make sure that individuals are attaining higher education? Do we need to change values and behaviors of individuals? I would say, yeah, and we also need to look at educational attainment as a report card, a performance measure for our educational systems. That's very different, because then that asks us, why do we have differing levels of attainment from community to community if we have the same system serving different communities? There's a difference there that's not just about the population. It's about policy, and it's about perhaps we're not actually meeting communities where they are and giving communities the equitable amount of resources in order to be able to do the thriving, the bouncing forward. And so that's where the data then, and really questioning, what am I really looking at here? When I look at homelessness numbers, am I looking at individual behaviors, or am I looking at homelessness as an output of our housing system? Both are true. Individuals can be unhoused, but you can also have a housing system that, because of policy, because of the decisions we've made around investments, actually produce homelessness as an outcome. Sit with that for a moment. So that's what we do with the predictive modeling, is that we create this understanding of, when you're looking at one particular outcome, you have to take it in its context. So we're not going to solve affordable housing issues if we're not looking at how affordable housing issues also interact with public education, also interact with how we police our neighborhoods. We know that there's a gradient there. Higher income neighborhoods are policed very differently than lower income neighborhoods. Those policing practices also lead to different contact rates. So of course you're going to have different arrest rates and different incarceration rates if fundamentally how you police an area is very different than how you police another. But if that's being informed by property values, that's not the only. Police practice isn't also being informed intuitively by property values. So are education outcomes. How we finance our schools are very much based on the local property tax rates. So you see, we have a system that many times we talk about it's broken, but it's absolutely producing as it was intended to do so. And it will continue to do so if we don't look at the data in a bidirectional means. meaning that these indices that have been right in front of us, there's no need to collect or create new proxies or new data points. These data points can tell us more than one thing. It's our willingness to be able to look upstream and ask those very tough questions. Why is it that we have policies that actually drive intentionally, reliably, the outcomes that we see based on race and place? That's how we create these predictive models to understand what are the different data points. And if you tweak, so let's say for housing, if you were to look at perhaps the differential voucher programs that we have. Well, voucher programs, housing voucher programs, tend to funnel people into the same zip codes, with a lot of these negative outcomes are co-located. You can't expect change if all you're doing is putting someone in the same zip code and you're not addressing some of the other issues. So whether those issues are access to substance abuse treatment, access to quality schools, public transportation, so individuals can actually reach the areas where there are opportunities for higher paying jobs, you can't expect them to somehow break out of a cycle that was meant to create the outcomes that you see that are co-located or aggregated in these areas. So by doing the predictive modeling, we're beginning to put these indices into one model so that you can look at if we have an investment that changes housing policy, while at the same time, we're also creating greater access to social or human services, what would we expect to see based on trend data as far as those outcomes of interest are concerned? And so it goes beyond just looking at the number of individuals that are homeless. It's also looking at individuals, their income levels, their ability to access economic mobility. That is what a full equity dashboard looks like. It's taking into consideration a constellation of data points, not just one particular data point that has something to do with one sector. It's the complexity of our communities, the complexity of our society, and the interaction of all these different policies that must be taken into consideration. Is it hard? Absolutely. But I'll tell you what's harder: living with inequity generation after generation. So I will put in the sweat now, because I truly believe that what we're doing right now is building that foundation for change. And at least on my watch, I feel like we have to do something to break this cycle of misery.
And are there places, Wendy, communities that you're working in, you think are really breaking the ground here and finding ways to be as intentional as you're talking about in how they are both using data and analytics and applying that equity lens to everything they do, and creating some transparency maybe in the way that they measure progress? Are there places you would point to?
Yes, the work that we're doing in the Resilience Catalyst in Public Health, this is work that has been funded by the CDC, and we partner with NACCHO, the National Association of County and City Health Officials. That is work where we have intentionally applied the Resilience Catalyst framework, and we're working with local public health departments to play that role of chief health strategist, meaning that you're intentional in putting together community voice with the cross-sector partners to get to those root causes. So in Louisville, the Louisville Health Department, Louisville, Kentucky, they chose to look at evictions, disproportionate evictions in communities of color. And in that work, they brought together, homeless advocates, returning citizens, individuals from both the tenant rights as well as owners, those individuals also from the tenant courts, the rental courts in Louisville, police. They had individuals from health services, from social services, to really understand if eviction is an outcome, what is the pathway? How do we get there? So that is the group being very intentional in talking to different experience levels, whether those are individuals with lived experience from being evicted to individuals who are landlords or those who deal with in the court system, sheriff's deputies who have to take part in the eviction process, or the servers for eviction. Because let's face it, if you're evicted, a lot of things have to go wrong. There isn't just one thing. It isn't just one missed paycheck, Why is it that you're living hand to mouth like that? And so understanding that pathway literally is what the group model building process was for. I mean, what it looked like in Louisville. And we understood that there were a number of different pathways, whether it was the pathway of a returning citizen, whether it was the pathway of a single mom, whether it was someone who had lost a job or someone who was working 3 jobs in fast food or some other service industry to try to make ends meet. And understanding not only how fragile that existence might be, but where other systems may fail. So whether that was access to substance abuse treatment, or whether that was because I had to make a choice between meeting with my parole officer or clocking in. And I knew that I needed to put food on the table. And so by having another criminal charge against me for missing a meeting with my parole officer, that meant that I had to spend 2 days in jail, and I completely lost my job. So understanding all these different policies, how they interact to produce an outcome, but you would not have understood that if you had not intentionally sat down across the table with these individuals to understand those pathways. And so that is the hard work, because that goes beyond just looking at the quantitative data. That means that you have to sit down and do, whether these are key informant interviews or whether they're focus groups, but really listen to the stories behind those data points. And that's exactly what the Louisville Health Department did in order to really truly understand what would a model for change look like. And that means it's not just redistribution of the housing vouchers or even just advocating for an expanded service area where individuals can use those vouchers. But it's also, again, getting back to that community resilience framework. What are the systems that contribute to these outcomes? And how can we reverse this trend by increasing intentionally access to services that help to offset the opportunity, the risk for an individual facing eviction? And then there's also this other piece of this is leaning into the conversation about the fact that many of these rules and policies were put in place specifically to harm communities of color. And let that sit there for a moment, because that is intellectually perhaps a much easier concept to digest than to actually then say, okay, but what do I do about this? How do I go about being that one that holds space for that conversation? And that's how, in the resilience catalyst work, that's the work that we do up front, is saying we have to keep saying why. Why is it that we see these outcomes reliably, predictably in our communities of color? And that's because we have to really come to terms with it was intentional. And when you look at both how policy is written as well as how it's discriminately applied, how it's translated into communities, then that's the work of being a resilience catalyst, is that you have to be a catalyst for change for the conversation and then to take action. And what they're doing in Louisville is very much leaning into that conversation, very much explicitly stating we have to talk about how these policies, how this practice is intentionally harming communities of color. But I do believe that being thoughtful, holding space for these conversations, we're not calling out bad people, calling out bad systems and bad policy, and coming to terms with the truth, which is a very difficult thing for us to do right now as a country, but it's a necessary thing to do.
So the work in Louisville, which is really a powerful example, involves sitting down and really listening to stories, as you described, the stories behind the data points. It makes me think of a saying that I think you sometimes use in your work, nothing about us without us. And I'm struck that your work truly centers authentic community engagement. So in doing the kind of work that you and your team do, who needs to be at the table, and why is that so important?
Well, yes, we've said nothing about us without us. But there's an even more difficult phrase that we've been saying, really, particularly since last year. And I think it's relevant when you ask the question of who should be at the table. So, quite frankly, yes, communities should be at the table, but white people have to come off the margins. I was really disturbed. I'll give you an example. I was really disturbed. This was before the pandemic. We had, and I can't even remember exactly what was the impetus for the conversation here on campus. We had an issue. I recall now. We had an issue. There was something very insensitive that was stated by our university president in a heated moment that basically posited as a response to another question about policy that had been voted in the majority by some individuals here on campus that will, quoting the president at the time, he said, well, if the majority voted to kill all Black people, would I do that? And you can imagine, like, why was that the first response that rolled off your tongue? Why would that be an example that would be appropriate when we're talking about a rule on fossil fuels? And that's literally what the conversation was about, divestment in fossil fuels. But it spoke to many of us, people of color, as it was insensitive at the least. But it also speaks to this understanding of a consciousness of what has been a conversation or a lack thereof with regard to the experience of color and the disposability of people of color. And so this was part of a larger conversation because a number of different statements have been made by this individual in the past. And so this was sort of like, for many of us, the straw that broke the camel's back. And so a meeting was called of staff and faculty to talk about how do we move forward and what should we ask for. In that meeting, there was only one white person. Everyone else that was there was a person of color. And I walked out and I said, I'm not going to be a part of this. And it's because, again, this is a human issue. This isn't just about me as a woman of color. So why isn't it that our humanity is not being awakened? So when you ask who should be at the table, every human being with a beating heart should be at the table. And I'm calling specifically on white people as well to sit in humility, but to also be ready to take action for change. Black people, people of color did not build this system, and largely they do not benefit from this system. If this is going to be dismantled, if we are going to disrupt, then those who have largely benefited from this have to be at the table to drive that change as well, have to work side by side to do that. That's who should be at the table. Yes, community needs to be at the table. Community needs to be heard. Community needs to lift up the issues, co-create the solutions, but so do white people. And so when we talk about, who should be at the table, point blank, that's who should be at the table. And until we start to see more of that kind of participation, I would say don't just ask community to carry this burden, and certainly don't ask people of color to carry this burden alone.
That's powerfully said. I wondered if you have any advice, given the power dynamics, when you think about public sector leaders who are at the table or sometimes see themselves as setting the table. And speaking to what you've just articulated, how would you recommend that some of our listeners who sit in some of those seats, how to show the kind of humility you're talking about, how to deal with the power dynamics?
Yeah, the power dynamics are so real because, after all, that's what this country is really built upon, your proximity to power. Some of the important work that we do in community is working, and you can find this actually inside of our Fostering Equity Guide. It's about understanding your proximity to power. We all have power, whether that's referent power, whether that's power because of where we are in our careers, or who we know, or what we know. Every person has power. And so understanding and recognizing your own power helps to not only help individuals how they show up, but their comfort level in showing up. And humility is such an important word, but so is curiosity. Oftentimes, those things that we react to that make us uncomfortable, that comes from fear. Fear comes from a lack of knowledge, a lack of understanding. But what if we were all just curious? What if you ask a person, well, what do you really mean by that? When you say those people, I don't want those people in my neighborhood. Well, who are those people and why? And then keep asking why. This is the power of the 2-year-old. It's okay to keep asking why and to be curious, to lean in. When you're uncomfortable, ask yourself, why am I uncomfortable? Why is it that I feel like I shouldn't be here? When we come from that true place of curiosity, that's when we can truly learn. And when we begin to really learn, we begin to really see each other. And when we can see each other, then perhaps we're not so afraid. We can ask ourselves, what in the world am I so afraid of? Am I afraid of losing power? Well, power is only as good as you wield it. And honestly, power is only good when we use it for good. Because when we use it to only prop up ourselves, that creates an even more fearful environment. Because you have a fear of someone taking something away from you that you know is illegitimate. And that's what's really driving this white supremacy work that we see going on. It's the fear of losing something that is illegitimate to begin with. Illegitimate gains that have been heaped on one part of the society, and I would say illegitimate adversity, chronic adversity, that has been the dividend for others. That's the real fear. So coming to terms with that truth requires that you keep going at the conversations that make you uncomfortable, the places where you feel like you don't belong. You do belong. We all are in this together, and we all have to do this very hard work together. That's how we set a table, and it's a movable feast. Sometimes, most of the times, we're actually going someplace else to have that conversation, because I want the host to be the one that is most comfortable. Usually it's the community that should be the host.
Thank you so much for sharing that, Wendy. I'm sitting here with lots of reflections, including what brought Karen and I to this podcast, and our desire to really bring different voices and perspectives together to ask questions and more questions. I think I've often said over the last couple of years, when I look at my own journey, that the thing if I have a regret, it's that I didn't ask the additional question or the question after that. And so that sense of really being vulnerable with each other, creating the space to be able to ask the question, but also to be truly able to hear it, I think is so important. And so we very much appreciate you joining us and sharing that a little bit of yourself and your journey and the work you do. It's powerful, especially as we're all looking for ways to be human, as you say, and really kind of come at the work from that as at the core of what brings us. And I think that really speaks to what you're sharing with us, and I appreciate that.
I'm just struck by the hope in talking about building a movement and in finding our way to resilience, and even in the midst of all the difficulty that brought us to want to have these conversations in the first place. So it's just exciting. And I think we will link to some of your resources so that folks can really go deeper on your work. And then anyone that you feel is influential in your thinking or that you would encourage other people to read or watch or listen to would be great. But I just want to thank you for the conversation.
Yeah, absolutely. As a final word, there are two ingredients in the community resilience model that you can go to our recent publication that was just out this month, that it's detailed. And there are two contextual elements that ultimately we have to always be aware of, and that's hope and fear. The role of hope in resilience, the role of fear in inequity. And there's science behind this. These aren't squishy things. There's actually a hope scale where we can measure the levels of hope in a community. And we know that has a lot to do with the belief in resilience. Do you believe that your community will support you? Do you believe that you have access to those things that can help you bounce forward and thrive? Fear, on the other hand, not so much. Fear undermines and drives so many of the negative outcomes that we see today. And here's the thing. Fear is instinctual. We don't have to try to be fearful. It is how we as a species have survived. So you don't have to do much to stoke fear. It's there. Hope, on the other hand, is not instinctual. Hope has to be nurtured. Hope has to be reinforced. So I ask you, today, when we see so much fear that's rampant, what is it that we're actively trying to feed here? Are we trying to build resilient communities? How do you build a resilient community in the absence of hope? How do you build resilience in the face of fear? That's truly what we are facing today. We can do all the advanced study. I can have all the data to crunch. But at the end of the day, if we don't build hope, we'll never overcome fear.
Our Dream Deferred, Fulfilling the Nation's Promise is an APHSA production, hosted by Tracy Waring-Evans and Karen Key. Editing and sound design by me, Brandon Mitchell. Our team also includes Christina Becker, Jenny Hogan, and Jessica Guerin. If you enjoyed this episode, please be sure to rate and review us on Apple Podcasts or wherever you listen.